This guy's been having chest pain for about 6 months or so. He's on multiple medications, continues to have symptoms. There is a sense of foreboding. They feel like they're going to die. And you go ahead and open the blood vessel, and literally within seconds, there's a sense of relief for them that the pain's gone, they feel a whole lot better.
Go to 12, go, so 2, 4, 6, 8, 9, 10.
12 and up down.
The radiation that comes from the X-ray machine is a constant threat to us, so we wear lead to protect ourselves. When you're wearing it constantly, and more importantly, when you're standing at the table, whether you know it or not, you tend to bend forward.
We know that anytime you place weight on the axial skeleton, that creates increased stresses on the musculoskeletal system. Moving over a patient standing for hours, dealing with catheters while wearing this weight can predispose or increase the risk in some people for what Dr. Iyer had, which is multiple disc herniations.
I could barely move. I could not stand. Even in bed, I couldn't turn. I had to lay on my back with my knees flexed. It was the only position I managed to stay in without any pain. And by then, I'd already had 3 surgeries. So when I went back to see Elad, he said, if this keeps happening, you're going to have spinal fusion, which may essentially put an end to your career as an interventional cardiologist.
Think about squeezing that quarter. Good. Big inhale.
For 6 weeks that I wasn't able to work and I did not work, there were a lot of patients waiting.
Exhale, 1 more.
And there were some patients who had the option of having a procedure done by somebody else who electively said, no, we're just going to wait till he's back to work. So it puts a lot of pressure on me to get better and get going. CorPath seemed to be a very interesting proposition. What the CorPath does is it allows you, after you've done your initial angiogram and you've got your catheters in place, to step away from the table, take your lead off, go sit down at a table where you have a robotic control of the wire, the balloon, and the stent, which needs to be loaded on manually. And from that point on, sitting at my console, deploy the stent where I want it, step on the fluoro pedal to look at X-ray whenever I choose to, and do the entire procedure sitting down away from the X-ray source, minimizing my radiation. The ability to very precisely measure, making certain that you can actually place the stent where you want it, because you can literally move the stent a millimeter at a time with the robot. And I often end up picking a different stent compared to what I would have with just a visual estimate.
Let's take a picture here, guys.
Absolutely a game changer for Dr. Iyer. He's really important to our institution, and CorPath gives us the ability to keep Vijay doing his work without the stress and strain, and perhaps maybe he won't have any more back problems because of CorPath.
Okay, go up. Looks pretty darn good, guys. All right, we're all set.
When I talk to cardiology fellows now, I will often hear, hey, I like doing this, but I'm not really sure I want to expose myself to that level of radiation or want to have lead all the time on me for the next 15, 20 years.
Wide, you can see the edge moving.
It's a big deterrent. What I want CorPath to become for me is the way of life. We do a diagnostic angiogram, and when we start to do an intervention, we automatically transition to the robot. And every now and then I will have to wear lead, to the point where it becomes a rarity. And now I'm not going into work every day dreading that maybe this could be the last day I'm an interventional cardiologist. This is what I trained many, many, many years to do. I don't want to give it up.